It feels like everywhere we turn these days, someone we know is dealing with depression. But how do we know if it's really depression or just a blue mood? What are the symptoms and how many symptoms does a person have to have in order to transition from feeling blue to dealing with active depression? As society struggles increasingly with this elusive condition, our need for more education on how to recognize and respond to it becomes paramount. A quote by C.S. Lewis says, "Mental pain is less dramatic than physical pain, but it is more common and also more hard to bear. The frequent attempt to conceal mental pain increases the burden. It is easier to say, 'My tooth is aching,' than to say, 'My heart is broken.'" And with that, I'd like to introduce our guest today, Sherry Campbell, a registered psychotherapist and social worker. Thanks for coming again, Sherry.
Thank you.
Now, I want to start off with, let's talk about what is the difference between a blue mood and depression?
Well, I think we can all relate to a day when we feel a little blue, right? That's pretty normal. It usually lasts 1 or 2 days at the most, and then it just kind of naturally lifts. But if it's persisting longer than that, more than a couple of weeks, then we're probably looking at something a little deeper.
So what are the possible symptoms of depression then? I mean, that the average person may not think of.
I think the biggest one that the average person doesn't think of is low motivation. A lot of times people will say, "I feel like I'm being really lazy," and it's not usually me. And so although sadness and, edginess or all those things can come along with it, low motivation, I think, is one of the biggest markers where you
Interesting.
just don't feel like yourself.
What about like being tired? Like,
Yeah.
yeah.
Well, this is the thing. When we look at the different symptoms, you have the mood one overall, like the psychological, but the
Yeah.
physical symptoms are huge, right? So headaches and sleep
Yeah.
difficulties and appetite changes. And oftentimes when I work with clients who have slipped into a major depression, they'll say, "You know what? It just hit me." But when we go back in time, there were a lot of early signs.
And I think that's part of the thing, which we'll get into, is like, so since there are so many possible symptoms or many phases of depression, can it be difficult to accurately diagnose and to properly treat it then?
Absolutely. I think that's when we need to know when to seek some professional advice. And that's where part of the education is really important, because even if we're having a bad day, that doesn't feel well, right? So the more that we know ourselves, we know our own baseline, the better that we can be aware of what we need to do to feel better.
Okay, so how can a person recognize depression in themselves, first and foremost?
So I would say if it's persisting more than 1 or 2 weeks,
Okay.
right, and it's not lifting despite, especially if you're saying, "You know what, I'm going for walks, I don't understand the situation, it's not like something has happened and then
Right.
it's lifted, you're not sure why it's hanging on, it's not related to grief, say perhaps," then I think a good place to start is to jot down, start to keep a diary of how you're feeling, and then check in with your family doctor.
And then as someone that has a loved one, because many times you feel lost, how can they try to recognize the symptoms in someone who may be truly developing depression and not just a blue mood, as we're talking about, something that's going to pass in a couple
Yeah.
weeks?
That's such a great question, right? Because so often we're quick to think, "Oh, Sherry's grumpy," or "Why is she
Yeah.
being so cranky?" As opposed to having an open-ended question like, "You're not yourself, Are you
Yeah.
feeling okay?" And because sometimes we'll notice that it'll be like an irritability, or we notice our partner, our friend isn't sleeping, or that they're a little bit more emotional, or just more angry.
It's and you don't want to jump to conclusions either, because you can get into, misreading somebody. But at the same time, if it's a loved one, you really want to be there for them as well. And
Yeah.
if there's something that you can kind of jump on and I say, hey, can I ask? I guess we're asking the right questions. Is
That's
that
right.
it?
I think being curious and just being concerned, and in our healthy relationships, that's what we do for each other. We listen
Yeah.
and we check in.
So
Yeah.
do you see depression as something that's a growing problem in our
Yeah,
society? Right?
yeah, definitely.
Yeah.
And I know some have said, it's because we're more educated about it, that we're learning more about it, and that people
Okay.
are being diagnosing more. So I think that may be part of it, but I don't think it's all of it. Like, I think we are on this really hectic, stressful life schedule, and it's not healthy. It
Well,
takes its toll.
I think it's something that we definitely, you're right. Education is one thing that's bringing it to mind, but at the same time, it's not just education, it's the fact that we're recognizing something that has been growing in society. So with that, we've just barely touched the surface on trying to decide what is blue moods and what is depression. So stay with us and we'll dig deeper into how to recognize this and how to treat it. We'll be right back.